Hello, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James. I am the owner of Limbs and Things. We're a mobile and telehealth physical therapy practice in the Washington, D.C. area, and we serve aging adults, helping you move from I can't to I can. This evening, we have Miss Jonelle Wallace-Spoon, and she is a pharmacist, and she's going to share a little bit about some of the things that she's experienced as a pharmacist treating people of our population or the ones that I serve. And she has a wealth of knowledge in dealing with health professionals as well as a layperson. And so we are happy to have you tonight. How are you?
I'm fine. How are you?
Good. And she also happens to be my cousin. Okay, so tell us a little bit about some of the things you experienced working as a pharmacist.
Okay, I'm going to start with the most practical thing.
Okay.
One thing most patients have to realize is that insurance companies are the boss. What they say is the final word.
Mm-hmm.
What I deal with 90% of the time at work is insurance and patients and doctor's office and insurance. And what they have to realize is um, insurances are going to push back against prescribing new drugs that have come out. Doesn't matter the population, against new drugs.
Mm-hmm.
Uh, so, what would make the process much easier would be if patients would have like their formulary with them when they go to the doctor. Each insurance company has a formulary. That's a list of drugs that they will cover.
Mm.
What I find is doctors have no idea what's covered. Patients have no idea what's covered. So they just say, "Oh, we're gonna prescribe XYZ drug." Well,
Mm.
guess what? It's not on their formulary. So they send the prescription to us. We're gonna process it. It's gonna come up back with a third party rejection or rejection from insurance.
Mm.
Not gonna get their drugs. The doctors, we have to be the go between the doctor and the patient. We have to tell them, listen, your
Yep.
insurance doesn't cover this. Well, why doesn't my insurance cover this? You need to contact your insurance. It would make the process so much better if
It
you use
would.
your formulary.
Yeah. And it's really interesting you would say that because until I became an entrepreneur, I didn't know the insurance aspect. And so a lot of us, when we go, everyone thinks that a health professional knows every area of what they do, but none of us really do unless we're working in that area. So your doctors probably they have no idea of how much it costs to see you, how much it costs for that medication or anything like that. So unless you're on the other side of it where you're dealing with billing, where you're dealing with knowing all of the different parts, the health provider just doesn't know. So that's good that you brought that up. I like that. What else you got?
It's just it would make the process so much more simpler. I mean,
Mm-hmm.
it's a formulary. It's really on the internet. You can
Yeah.
put in that year, put in your name of your insurance company, and put the formulary, and it pops up. It tells you everything that they cover, first tier, second tier, third, all of that. So
Mm-hmm.
that go to the doctor, you have that. You can give that information. Say, listen, you want to prescribe a new drug for me? Well, this is what my insurance covers. Okay,
Mm-hmm.
it's on this list that you can prescribe for me. And
Now,
then
is that first, second, and third tier? Sorry to cut you off. Is that like generic versus non-generic brand? Okay.
exactly.
Okay.
So if they knew what the insurance would cover, they could choose from that list. And if it's something that's not on that list, then you know you're going to have a fight on your hands. You're going to have to do a third. You're going to have to do a prior authorization with the insurance company. They have 72 hours in which to approve or not the drug. Most of the time, they will approve it, but your copay is going to be
Right.
astronomical.
Mm-hmm.
But if you knew all this going in, at least you can kind of cut the process short if you have your list with you when you go to the doctor. Put the ball in their court so that they can prescribe from your formulary. Therefore, you don't have to fight with the insurance company.
Or with you, right? When they come to the pharmacy.
Yeah, they think it's our fault. Why? My doctor wants me to have this drug. Why aren't you giving it to me?
Mm-hmm.
Insurance is the boss. That's all I can tell
Absolutely.
you. They're
Yeah,
the boss.
that's
Also,
true. Yeah. Go ahead.
also, there's this thing that's called the beer. That's more on our end.
Say that one more time.
The beers list.
B.
BEER, like a beer you drink.
Yes.
Beers list. That's a
Okay.
list medications that's really not recommended for people over the age of 65. Or
Mm-hmm.
if it is, it's only like in certain scenarios that it's okay. So the doctor is supposed to check that list to make sure that the drug that they want to prescribe is either not on that list or the benefits outweigh the risk. Because as you get older, your body does not process medications like someone who's in their 20s or 30s.
True.
So you have to take that into consideration. That's why they came up with this beers list. It's updated every 3 years. It's from the American Geriatric Society. Um, and that's something that we take a look at. You know, whenever there's a drug that's prescribed for a patient and they're over 65, our system will automatically red flag it if it's on
Mm.
that list. Then we have to look further into it, and then we have to make the call to the doctor, say, hey, this drug is on the beers list. Does the patient really need to have this drug, or is there something else you can prescribe?
Hmm. You would think
So
they know that.
yeah, you would think, but not always. But you would,
Okay.
yeah.
Okay,
So
so I'm gonna put up some of the points that I heard you say. So have your formulary list from your insurance company about what your insurance provides and take that to your physician so that the one who's just prescribing the medication can make sure it's going to be covered when you go see it as the pharmacist. Is that
yes,
right?
yes.
Okay. And then the beers list.
Mhm.
What else did you want to say?
Secondly,
Mm-hmm.
I know it's tempting to go from pharmacy to pharmacy to try to get the best price on your drugs, but going to more than one pharmacy, we can't see what each other fills. So therefore, if you get a drug filled with me, but you have two or three drugs filled at a different pharmacy, I'm not going to be able to see what you're filling over there. So I can't check for an interaction with what you're taking over there with what I'm prescribing, what I'm going to be dispensing over here.
And that's regardless of if you're in the same company, like if you're at Walmart, if you're at Walgreens.
Right. But if you feel at different Walgreens, they're
Mm-hmm.
centralized. They can see what you feel everywhere at each
Okay.
Walgreens. But if you're feeling, say, at CVS and Walgreens, we can't see what you feel at CVS. So we can't look for an interaction.
Mm-hmm.
My advice is pick a pharmacy and stick with it.
Got you. Okay, and just to reiterate, the beers list, we can obtain that online from the American Geriatric Society, and it's the list of medications that people over 65 should not take.
Right. Or there must be a really good benefit, more benefit than risk
Got it.
for you to take that medication.
Okay. And I'm listening for the next one.
Those were really the high points as far as what I would think most patients don't know.
Mm-hmm. So, what about the ones who they see these things online and not necessarily something you get, or sorry, on TV? Because at nighttime, there are a host of things that are just for a certain population, and they're
Oh,
always up and they can see it. So, like Omega XL and some of these other things that people are telling me about that does not require a prescription, but they want to, call the number and have them deliver it to them.
that's another thing. We, as pharmacists, we can't see what you're taking over the counter. There is nowhere in our system for us to be able to say, "Oh, this patient takes this, that." Some over the counter medications interact with prescription drugs, like a lot of your fish oils. If you're on a blood thinner, you have to be careful. If you're on
Yeah.
if you're on Xarelto, if you're on clopidogrel, you have to be careful. So just because it's over the counter doesn't mean that, oh, it's 100% safe. I know they put that on the infomercial, but it's not safe for everybody.
Right.
You need to let us know what you're taking.
Mm-hmm. Absolutely. I think that's a good point because there are a lot of times we just think, oh, I'm in pain today. Let me just call this number and I can take it with. Now, I have a lot of people that take supplements, they take brain food, they take the flaxseed oil, the fish oil, all of those things. And then they have a whole other list that's a list of prescriptions. And then I'm wondering, like, Wonder why we're having some other issues, that something that is out of my scope as a physical therapist. So
There
I'm
is
glad that you bring that up.
there is no centralized system where all of this comes together, where we can see everything that you're taking prescription wise and everything that you're taking over the counter. There,
Mm-hmm.
the only time that really happens is once a year. Most insurances will pay for, they call it MTM, medication therapy management. That's where you have a one-on-one consultation with a pharmacist once a year, and they go
Mm-hmm.
through all of your prescription drugs, no matter where you fill them. And we ask you, what are you taking over the counter? And we put that in. And that's
Mm-hmm.
what we see, if there's an interaction, and we'll tell you, and we'll print it out and we'll send it out to you. Say, this is our recommendation. But it only
How do
happens.
you get now? Tell me, you said your insurance company pay for one of those a year. So how does that happen?
Well, your insurance company sends like a file, and if
Mm-hmm.
any pharmacy has access to this file, let's do the program medication therapy called outcomes, medication
Okay,
therapy,
makes sense.
and you can access that file. You get all the patient's information as far as their insurance and everything, what all they take prescription wise,
Mm-hmm.
because the insurance, anything that goes through the insurance knows what you're taking. So they're going to send that list to us. We're going to see it, and then we contact the patient, and then we go through each of your medication one by one and say, listen, how are you taking this? You know, have you had any side effects? If you're on a statin, have you had any muscle cramps, muscle pains in your legs? If you're on blood thinners, have you had any signs of bleeding? We go through it. It's a one-on-one consultation, and we take our time and we go through the list with you.
Hmm.
Then we ask you, what are you taking over the counter? And we document it, and we put it on your list, and we send it back to you, and the insurance gets it as well.
But now that has to be ordered by the insurance company to you. Uh,
Insurance company pays for that, Yeah,
yeah. Okay, yes, they pay for it. So
yeah.
they are sending it. Now, how does that work? They send you every one, or they just send you certain one?
They send you a file, and if you're like Walgreens and you have a special area, and all they do is deal with that area, it's enough there to keep you busy 8 hours a day, 5 days a week, 365 days a year.
Wow. Okay. Interesting. So nobody can request this. It has to come from your insurance company. Okay.
I mean, your big ones, I've seen all of your big companies, Humana,
Mm-hmm.
uh, Aetna, WellCare, your big companies.
So up
You
here we
know,
have like Blue Cross Blue Shield, Cigna.
right.
Um,
Not all of them will. Some of them, they like to keep their stuff in-house. Where
mhm. Now, what about Medicare? Do they do that?
Medicare does do that, especially if you have that Advantage plan. Usually it's going to be Humana. All of
Okay.
your plans, they pay for that. So
Interesting.
once a year, you will get that consultation if you're with one of those companies.
Okay. That's something I did not know, because I actually was at a networking event, and it was a pharmacist there, and he was doing these, and I was like, aren't people's insurance supposed to cover this information? So that's good to know that you do, but it should be requested from the insurance company, not the person
Right,
directly.
right.
Okay. Got it. Okay. Tell me something in particular that the oils or the supplements do that you should be aware of when you're taking prescription drugs that people may not know.
Well, it's basically it interacts with your blood thinners. It's something that's more technical than I can get in, but
Mm-hmm.
there's an interaction there where it increases the risk of bleeding. That's
Mm.
there's an increased risk of bleeding, so you have to be careful which blood thinner you're on and what fish oil you're taking. Also, for men, if you're taking fish oil and you're a smoker, there's a higher incidence of prostate cancer. Excuse me, prostate cancer.
Mm-hmm.
So
Interesting.
be careful. Something went down my throat.
You all right over there?
I know.
So fish oil and prostate cancer, with if you're smoking.
Right.
Okay, got it. You okay?
I am.
Okay.
Someone. Okay.
Okay. So that's a good point. Now, what were you saying about statins that we should be aware of also?
With statins, the number one side effect is muscle cramps, especially in your legs. And the way that you will know it is from statin. It only happens when you're in bed. When you
No way.
when you're in bed and you get that bad cramp,
Mm-hmm.
got to get out of bed to walk it out. It's the statin. So we found that there are two statins that have the fewest incidence of muscle cramps. Your doctor, it's rosuvastatin and pravastatin. Those two have the fewest incidence of that muscle cramps and joint pain.
And so, I'm seeing so many people with having those issues. So, and it's very interesting that neither one of those statins are being prescribed. It's atorvastatin mainly.
It's the number one statin that's being prescribed.
Yeah.
And most people get that side effect from atorvastatin.
Mm. All right, I'll be reviewing some more medication in the coming weeks. But that's really important because a lot of times when we're having muscle cramps, like I have a person right now who has a total knee replacement, and the knee is contracted every so often because we're having muscle cramps that are preventing them from being able to bend their knee. And what do they take? Atorvastatin.
Oh my goodness.
Yeah. Okay. That's good to know. Thank you.
Now, here's another thing.
Mm-hmm.
There is over the counter. Your body naturally produces CoQ10, coenzyme Q10.
Yes.
What has been found in studies, if you take a statin and you're having those muscle cramps, if you take CoQ10, it decreases the amount of muscle cramps that you have. Because when you're on long-term medications like for cholesterol and blood pressure, your natural amount of CoQ10 lowers over the course of therapy. And when it gets to a certain level of being low, you're at more risk of having muscle
cramps. Yeah.
So if you take CoQ10 at the same time that you take the statin, then you won't have the muscle cramps, muscle pains. Also, the best time of day to take a statin is at night because your body produces and stores the majority of cholesterol at night when you're sleeping. Right. So take the statin at night.
Now, what about these people who are having to take it more than one time a day?
No, you should never take a statin more than once a day. Only once a day at night.
Got it. Okay. And CoQ10.
Take CoQ10 at the same time as your statin, and you will find you won't get the muscle cramps. So say, for instance, if your doctor doesn't want to prescribe rosuvastatin or pravastatin, and they want to stick with the atorvastatin, CoQ10 when you take your atorvastatin.
Good to know. Okay. I'm learning a lot from you.
I didn't think it would be that way.
I don't know why. I don't know why. Okay, but this is good because a lot of times, I hear a lot of people, they have their remedies about how to do it the natural way. I'm going to eat some mustard. I'm going to have what else did they tell me? Apple cider vinegar.
Oh, here's another one over the counter. Red yeast rice. That's what I'm going to take. I'm going to take red yeast rice rather than take a statin. Well, guess what? Red yeast rice is very similar to lovastatin.
Well, everything derives from a plant anyway, right?
But the thing about it is, when it's over the counter, there's no monitoring of it. It's not, the manufacturing process is not monitored. So you don't know what you're getting, really, in essence.
I hadn't heard that one about the, what'd you call it? Red something rice?
Rice.
Red yeast rice. Okay. Okay. Anything that you think we should be aware of as we get older and we're still on the same prescriptions we were on a couple years ago? Is there something we should do, say, or be aware of that could possibly affect our health?
When you've been on long-term medication, your body is very, very smart. It can become accustomed to medication that you've been on forever and ever. You really should be going to your doctor and seeing if your medication needs to be adjusted up or adjusted down. Because as you get older, your body doesn't process medications the way it used to. As you get older, you have a more sedentary lifestyle, so you're not as active as you once were. That plays in metabolism of drugs.
Mm-hmm.
So your doctor needs to know, well, doc, all I do is sit on the couch all day. I don't do anything. Okay, well, maybe we need to adjust your medication because your medication was prescribed when you were up and about, moving, doing things. So you were metabolizing the medication and everything was working fine. Well, as you get older and you slow down, maybe your medication needs to be adjusted.
So based on your lifestyle change, not necessarily on your age or how long you've had the medication.
Right.
Okay. Very good. Okay. What about the person who has a certain drug and they're noticing I'm starting to feel a little differently than I was feeling before, and I'm trying to pinpoint if it's the drug or if it's something else, and if I need to consider calling my physician and seeing if we can get a medication change, because yes, I really am experiencing side effects.
You definitely need to contact your doctor because something is different. It also could be that what we do in the pharmacy industry, several manufacturers of the generics. There has to be at least 10 companies for each generic drug, at least minimum of 10 companies that manufacture a particular generic drug. The active ingredient is the same, but the inactive ingredient is different. Some people may be more sensitive to the inactive ingredient. Like, for example, my mother, towards the end of her life, had been taking metformin and no problems. And she just suddenly, she started itching. She would just itch, itch, itch. She went to the doctor, told them and everything, and they couldn't figure out what was going on. Well, just so happened one day, a lady called and she said, did you fill my metformin? I said, yes, ma'am, your metformin is filled. She said, which manufacturer did you use? And I told her, she said, oh, no. I can't take that one because when I take it, it makes me itch. My mother, exact same manufacturer. Switched her manufacturing, the itching stopped. So be aware when the medication changes.
So that's a really good point, though. A lot of us wouldn't even know to ask that. And so, how long should you go before you start experiencing symptoms or know that you're having a side effect reaction?
It's usually going to happen within that first week of taking that particular manufacturer. You're going to notice a difference. As soon as you notice it, stop. What did I just feel? You look at what you just feel. You may have filled it 2 weeks ago, but you had to take the last little bit of the other, you had a little bit left.
Yeah.
After, you finished the last little bit of the other one, and now I started the one that I just filled. It's a week since I filled it. You know what? I feel a little funny. It's the manufacturer. More than likely, it's the inactive ingredient that's being used. For some reason, you're sensitive to it.
So is that a question for your physician or for your pharmacist? Because it sounds like the lady contacted you, right? Okay.
Yeah, I would first call the pharmacist, and you really have to kind of keep an eye on when you're feeling things. So you call me, say, listen, my name is da-da-da-da. Can you look and tell me what were the last 3 medications that I filled and tell me the dates that I filled them? And then once you narrow it down to, okay, it was either this drug, or this drug, then it's like, okay, look and see who was the manufacturer that I had previously of this particular medication. And you're going to really have to do the detective work. Kind of get your pharmacist on board. Say, listen, I'm starting to feel this, and I didn't feel this before. I've been on this medication forever. I've never had this problem. Is there a new manufacturer that you all gave me? They'll look and they will tell you, okay, Yeah, it was it. Then it's at that point is when you have to make the decision. Okay, am I going pay for it? Because insurance isn't going to pay for it again because you just filled it. Am I going
Right.
for 5 tablets and take those 5 and see if the itching or that feeling goes away? If the feeling goes away, then it was that inactive ingredient at that other manufacturer. You have to be your own advocate, your own detective.
Good to know. Okay. So if you're having side effects, we should contact the pharmacist and figure out, hey, is this a different manufacturer than what I had previously? And maybe I need to adjust it if it's been a week and I'm starting to see symptoms. Is that right?
Yep.
Symptoms of the side effect.
Mhm.
Okay. Good. Okay. Now, this is on a not so pleasant note. I've had a couple patients to pass away who've been taking medications, and their families have been trying to decide what they should do with them. Should they just throw the pills in the trash? Should they flush them down the toilet? What should they do? What's the best way to dispose of your pills once you no longer need them?
The best way, most pharmacies, there is actually a website you can go on. It's by the FDA,
Okay.
where it will tell you all of the drug disposal sites within your zip code. You go on this website, I think it's FDA. Oh, I have to look it up.
Okay.
But you go and you put in your zip code, and it'll tell you where the nearest drug disposal site. Walgreens has a lot of them. CVS
Okay.
has a lot of them. Well, they will dispose. It's a kiosk where you go in there, you just put the medication in there, you dispose of it. You're done. If you're at home and you don't want to do it that way, for like capsules and tablets, what we
Mm-hmm.
suggest you do, you take one of those plastic bags that you get from the grocery store and the different stores. You pour the medication in the bag. You put something in there distasteful, like coffee grinds, eggshells, dirt, something distasteful. Then
Okay.
tie the bag up, throw it in with your regular trash. And with the bottle that has the label still on it, you want to either mark off the information on the bottle or pull the label off altogether, ball it up, and then throw it in your trash where it can't be identified what it is.
Mm-hmm. Okay. And what are these coffee grounds or something distasteful doing to the pills?
It's not doing anything, but if you have good sense, you don't want to put something out that you see that has dirt on it. That's going to
Gotcha.
deter them from wanting
Hmm.
to take it. So,
Gotcha. Okay, so it's just a deterrent, not
yeah,
necessarily something that's going to
yeah.
disintegrate the pill. Okay, I got it. Oh, that's good to know because there are even other people who are still their doctor has prescribed a different medication and they don't know what to do with the previous one, and so then they're trying to decide, okay, what should I do with this? So that's good. We can go to the FDA and look up the proper disposal site so we can take a Ziploc bag or and put something distasteful inside of it and then throw it in with our trash after we take the label off the bottom. Is that right?
Yep.
Okay. Sounds good. These are really good tips. See, didn't think you knew all these
Didn't
things.
think I knew.
Okay, so let's go back over. The first one was about having your formulary list from your insurance company, right? You want to say
Mhm.
anything else about that?
No, no.
Okay.
That's going to save a lot of time in and of itself. If everyone
Mm-hmm.
is informed at the beginning of the process, then there'll be less stress at the end of the process.
Right. So take this to your doctor's office
Okay.
so that when they do prescribe, then you'll have all of the information to
Right.
know. We won't get upset at the pharmacy.
Exactly. That's the whole
Okay. Yes. And then the second one was about the beers list, right?
yeah.
Okay. And we should get that from the American Geriatric Society's medication that people over 65 should not take. However, if it's
If the
good
benefits
for you, thank you. Go
outweigh
ahead.
the, then it's okay to take. So it's just like a checklist where you kind of checking to make sure that your doctor is doing his or her job. Are
Got
you prescribing this for me? Okay, I see this is on this beers list.
it.
Uh,
Hmm.
do I really need this medication, or is there something else you can prescribe that's more appropriate for someone my age?
Question. Just because I'm thinking about it. A lot of people get prescribed Eliquis. Do you have anything you want to say about it?
I fill a lot of Eliquis prescriptions.
I know.
Anytime it's a blood thinner, it's always there's a potential for the number one side effect of bleeding.
Mm-hmm.
You have to be careful with Eliquis. If you take it twice a day, that means every 12 hours. That does not mean taking it. I take the first dose now, and then 8 hours later, I'm going to take it again. No, it's every 12 hours. Because if you take it too close together, you're increasing the risk that you will have bleeding.
Bleeding.
Symptoms
Mm-hmm.
of bleeding are black tarry stools, um, pinkish urine color, pinpoint red dots on the skin. You have to take the medication as prescribed. Eliquis, the one thing that I really, everybody loves Eliquis because you don't have to go and get your INR checked like you did with warfarin. Oh, I don't have to go to the doctor to get my INR checked.
Yeah.
But the thing about it is, you don't know you're bleeding until you start bleeding with Eliquis. At least with warfarin, your INR would tell the story to say, hey, you know, you're it's a kind of high. What have you been
Mm-hmm.
eating? What are you doing? There's less monitoring. With a drug that's going to increase the chance of bleeding, you really do need to be monitored.
Mm-hmm.
That's my personal opinion.
Yeah, agreed. Because on the PT side, there are people who are running into things and bruising themselves, and then they have these little areas of blotchy purplish color on some people, and then pinkish on others. And we're wondering because I've seen these little red dots on people, and I'm like, and what are you taking? Okay, you probably need to go see your physician about that. So there are definitely important things that we know about that we just need to do something about before it becomes a bigger issue.
And this is an important conversation that needs to be had between the patient and the healthcare practitioner. Listen, if you notice this, you need to either call us,
Right.
give them an action plan. Don't just
Mm-mm.
prescribe it and think that they're going to know because they don't.
They won't. Right. And it takes somebody else seeing it, and then they're wondering, well, do you really know? And then we're trying not to tell you what we really think. So we think
Exactly.
you need to just go see your physician. So, yeah, I totally agree with that. Okay, here's the third one. Doing the medication management therapy, but this has to come from your insurance company, where the pharmacist reviews all of your prescriptions over the counter or prescribed drugs one on one.
Mhm.
Okay. And we talked a lot about statins and muscle cramps and how we can use CoQ10,
Yep.
right? Okay. Anything else you want to say about that? Tell me the drugs again that have the lowest rate of having muscle cramps. That's a statin.
It's easier to remember the brand name Crestor and
Thank you.
yeah.
Yes, Crestor and Prevestatin. Now, pharmacology was like one of my favorite classes in PT school, and so I always look at the end of people's drugs, and you don't really have to tell me your past medical history. I can just read it from your drug list, but having the name brand for a lot of people is helpful because that's all they know is Crestor and what's the other one?
Pravastatin.
Prevestatin. Gotcha.
Pravachol, which is not as easy, but Pravachol and Crestor,
Okay.
two
Good.
brand
I
names.
know some people on Crestor, so that's good. They've been prescribed the one that doesn't give them as many muscle cramps. Okay. All right. And then we talked about side effects and manufacturers, and you talked about your mom with itching and how we should adjust the manufacturer because the ones who have generic brands, they are by, what'd you say, the least amount or the minimum is 10, right? That you can have that have the generic brand, but they also have different inactive ingredients. Is that right?
Exactly.
Okay. And that's important, especially because some of us are quite sensitive to things that we don't even know we're taking.
You don't even know that you're sensitive until you don't know you're sensitive until you actually have it. Like some people are sensitive to sulfur,
Right,
and
right.
you have no idea until you take it. It's like, oh, what's going on? I'm itching. I'm
Mm-hmm.
breaking. You have a sulfur allergy. You didn't know it.
Mm. And then the last one we talked about was people who are trying to get rid of their medications and where to dispose of it properly. And you also said, in addition to the FDA, that you can put it in a Ziploc bag or something that doesn't taste very good by itself,
Mhm.
like the coffee grinds, and then put it in the trash, along with taking the labels off of the bottles.
Mhm.
All right. Well,
That's
this was good. I learned a lot.
did you?
And I think that a lot of people watching, if you have a question, you have a comment, you found this information helpful, you can type replay in the chat or live if you're watching it live. And if you have a question, you can also write that, and we'll get back and answer you. Anything else you want to leave as a final thought?
No, just realize that the pharmacy, they're really not your enemy. We're there to we're like the middle person. We're the person who the doctor contacts and the patient contacts. When the patient can't get in touch with their doctor on the weekends, guess who they call? They call us. So
Really?
we're here, yes,
Oh.
more questions about medical things that have nothing to do with drugs.
Mm-hmm.
They call. I've called my doctor, but they haven't called me back. What should I do? So we're there to help.
Yes.
We're not your enemy. We're there to help. We want to see you have the best outcome with your medications, and just realize that. Be a little nice to us sometimes.
Well, that's good. That's very good information, because I think a lot of us think that the person who's telling us no is them telling no from themselves, and it's
Yeah,
really it's somebody else that's dictating how things work.
insurance is the boss.
Absolutely. Yep. Okay, so one more thing. Those people who don't have insurance and they want their prescription drugs, tell me a little bit about how that works.
If they don't have insurance,
Mm,
well, all I can tell you about is Walgreens. Walgreens has a prescription savings club where you pay $25 a year, and it
mhm,
covers generics. You get a discount on your generics. If not, there's always goodrx.com. You don't have to pay
mhm,
anything, it's free. There's singlecare.com, another one. All we need as pharmacists is the information. Once you put in the drug and it tells you what the price would be, it tells you at each pharmacy what your price would be. It's a code that they give you. We need that code. We put it in, you get that price.
That's good to know, because they're, as open enrollment comes and people are trying to decide, should they get Part D or should they decide if they want to do something different with their pharmacy plan. I think it's always helpful to have all of the facts so that you know what's the best thing for you to do. So thank you for sharing that, and thank you for all of this information. I think that it's going to help somebody, because it has helped me too.
And I can help.
Yes, absolutely. Okay, thank you, everybody. Have a wonderful day. And thank you so much for joining Pull Up with Limbs and Things. Remember to share this information with somebody else. And we hope that you have confirmed something you know or challenged something you don't know. Take care. Bye bye.